Hello, and welcome to National Public Health Education Week. This is one of my favorite weeks of the year, and health education is one of my favorite classes to teach. Nationally today, the focus is on health equity. And so I wanted to take a minute to just define this for us and really uncover what is health equity versus health equality so that we don't mix up those terms. Health equality is treating everybody the same. Everybody gets the same amount, everybody gets the same resources, we're good. But health equity meets people where they're at. It looks at needs because they're very different based on the person. We all start at different places. And so in public health, we strive for health equity. And I'm going to give you a personal example so that we can help understand this a little better. I have permission from 3 of my dear friends to share parts of their stories with you. The first friend is Mallory. We've been best friends since high school, so for a very long time. When Mallory was born, she had a number of different health conditions that she struggled with and still does today. And so for her as an adult to maintain health and live, she needs to have assistance with transportation. She needs to see multiple doctors, and she's got a number of prescriptions that keep her alive. Then there's my friend and sister-in-law, Sarah. Sarah struggles with asthma, and she lives in a very remote town, and so there aren't as many specialists available, so she has to have transportation costs to go into a bigger city to see a specialist and then get her prescriptions for her inhaler. And then there's my dear friend Christiana, and some of you might know her as Professor Altamirano. She's very healthy. She maybe sees the doctor for her routine visits and doesn't have any prescriptions associated with that. So her only cost would be the copay at her appointment. And so if we look at these 3 scenarios, these 3 friends of mine, from a health equality standpoint, let's just say I have $300 to give them. If I was treating them all the sameness, right? I would give them each $100 and say, go have your doctor's appointment, and that's that. For Mallory, $100 would not be enough. It wouldn't cover everything she needed with transportation, multiple appointments, and lots of prescriptions. For Sarah, it would probably be enough. It would cover transportation, a doctor's appointment copay, and then her copay for her inhaler. For Christiana, it would be far too much money. She just needs her copay covered, and that's all. She doesn't have transportation issues because she lives in the city and doesn't have prescriptions. So you can see if we treat them all the same, they're not all coming from the same place. And so it doesn't help Mallory enough, and it gives Christiana too much. But if we take that same $300 and we look at it from a health equity standpoint, we would say, let's give Mallory $200. That would cover her transportation, multiple copays for her visits, and also enough to cover the copays associated with all of her prescriptions. For Sarah, we'd give her $75, about $25 for transportation into the city, $25 for her copay for her visit, and $25 for her copay for her inhaler, and that would work. And then Christiana, we would give her the remaining $25, and that would cover her copay at her visit, and she doesn't need anything beyond that. And so with health equity, we're meeting everybody's needs. We're giving everybody a chance at health based on where they're at. We're not treating them all the same because they aren't all the same. They're all coming from very different places. And so that's why in public health, we strive for health equity. We do this with individuals and with communities. When I work in other countries, sometimes I work with tribes that are so remote that they have no access to healthcare or limited access to water and food. And so I already know those communities are going to take more resources and need more programs and need more funding compared to the ones that are closer to cities that have doctors that are close by and have access to prescription medication and clean water. And so you can see we don't treat every community the same, and we don't treat every individual the same. We meet them where they're at with their health needs because we all start at different places. And so in public health, we always strive for health equity.